Another issue that happened, and this was particularly dramatic and colorful in San Francisco, are there those who are kind of on the libertarian side of things who just don't want to wear face masks. There are those who found it to be an assault to their freedom, and also there were women's groups that complained that it was just not very attractive to be donning face masks. Some of them came up with their own versions, like chiffon face masks and the like. So you actually had an anti-mask league created in San Francisco that had, several protest meetings and so on. So you have this pushback, and in instances, the policemen were required to fine and drag people down to the local jail who weren't adhering to the face mask law. So it really caused a lot of conflict, and there was a lot of pushback. And California's health commissioner, who did a study after the fact, was able to show by comparing these epi curves that I talked about, we're comparing the impact of the pandemic in different cities, that it didn't matter if in cities that ordered and didn't order masks, really the outcome, was often the same, or those that had face masks fared worse.
And there were cities that instituted non-pharmaceutical interventions, but actually suffered high morbidity and mortality rates nonetheless. And what you found there was that there was a list of sins underlying that had nothing to do with transmission of germs, but more to do with human nature and politics. What happened in some of those cases?
Well, I think that that's a really good point, and that's one of the reasons why the conclusions from our study is that these MPI need to be implemented in early, sustained, and layered fashion. So often, or in some cases, cities implemented what we would say would be the right menu of measures, but they did it too late. Sometimes, and there are instances of that, or they would implement them and then deactivate them and reactivate them. So that it's interesting. You can find curves in cities where these non-pharmaceutical interventions are implemented, then they're let up for a week or two, and you see the cases and the deaths begin to rise, and then they're re-implemented, and the curves go back down, but by then the population is often quite restless and upset that they're having to adhere to these a second time. And you're absolutely right that, there's fascinating issues of politics and also of civic society that have a lot to do with how a particular community responds in a crisis like this and to these public health measures. So I'll give you an example of the city of Newark, New Jersey, where you had a mayor who was not interested in listening to the public health commissioner and was on either the local or the state level and refused to implement some of the recommended public health measures, and in fact got into a rather heated squabble that went on about whether or not saloons, which were important gathering spots often for immigrant men, would close or not close. There were many more instances of the kind of pushback I've talked about with the face masks in terms of protesting prolonged closure of the schools or wanting there to be certain things implemented that weren't implemented and so on. I think one thing that we can definitely take away from 1918 is that cities that tended to do things in a more harmonious fashion often had multiple, what we would call today, multiple stakeholders at the table while the plans to mitigate and deal with the pandemic were unfolding. Often these were called special influence advisory boards, and they included leaders from the Board of Education, they included nurses, they included physicians, they included public health people, and very importantly, they included business leaders, because you really needed business leaders to be on board and to cooperate when it came to things such as closing down the theaters or having staggered business hours, or getting their employees, if that was the case, to wear masks, even though we've just talked about that masks might not have been that effective. So having these multiple stakeholders at the table and really having a sense that this is a community effort where what is at stake is being explained transparently and is being communicated to the population at large is really important.
The world we live in today is quite different than the world of 1918. We're more interconnected and harder to isolate. at the same time, as you mentioned at the top, the Internet is allowing a much greater flow of information much faster. So what are the challenges of containing an influenza outbreak today, and how does the rapid exchange of information change that dynamic?
Well, I think, first of all, we can't contain this epidemic or this outbreak. I mean, it's just not containable, and that's something the WHO has gone on record saying. Because of rapid air travel, because of just the massive movement of people on airplanes and other forms of transportation, I think one thing that, looking back at 1918, it's important to remember is that pandemic unfolded in the time of war, as the U.S. was really training so many men to go off to the European front, and you had heavily trafficked railway lines and very crowded encampments of soldiers who were often the ones who fell in and who died in such high numbers, consistent with that age group. So I think that there are some similarities in terms of dense urban populations, crowded transportation, methods of transportation, but obviously airline travel takes it to a whole nother global dimension. And I think that the Internet and the information technologies we have are really we're using them and can use them both for better and for worse. On one hand, they have made, as I was saying before, they have made a kind of instantaneous epidemiological surveillance possible, so that cases from across the globe, from the biggest cities to the smallest villages, are being reported on basically a second-by-second basis. And also samples are being, tested very quickly in terms of getting back laboratory confirmation and determining whether something's a probable or confirmed case. On the other hand, people are now all running to the Internet and typing swine flu into Google and getting back all kinds of different information. Some of that information is quite reliable. Obviously, if you go to the CDC or the WHO website or the website of your city or state preparedness plan or health department, you're going to get very good and up to date and accurate information. But with the world of the blogosphere and just really everything that's available on the Internet, there are also what we'd say bogus information out there, as well as a lot of rumors that are flying around. So it's really bringing out kind of the best applications in terms of public health and surveillance, and has great potential in terms of public health risk communication. But there's also real concerns in terms of just spreading rumors and misleading information, and frankly scaring people so much that they're not able to take the kind of action that is appropriate and helpful for themselves and their communities.
So if there's one lesson to take away from 1918 pandemic that you tell to a public health official, what would that be?
I think that I think there's more than one lesson, but I'd say one of the most important is transparent communication from the top to the bottom in terms of consistent messaging of what are people being told, how are they receiving that information, so that people don't get confused, and they also trust public health officials, and they don't lose that trust over the course of what could be several weeks or several months of dealing with this particular virus and its journey across the globe as we see what happens.
Alexandra Stern, Associate Director of the Center for the History of Medicine at the University of Michigan. Thanks so much for your time today.
Thank you so much. Have a great afternoon.
Thanks for listening. To order a copy of Biotech 2009 Life Sciences, Navigating the Sea Change, Burrill & Company's 23rd Annual Report on the Life Sciences, go to burrillandco.com. That's BURRILLANDCO.com. And be sure to join us at burrillreport.com for daily coverage of the life sciences industry, and sign up for our free e-newsletter, the Burrill Weekly Brief, by hitting the sign-in link at the top of our website.